So growth period. The only thing I've seen them ask personally, and please chime in if you all have seen something that I'm not bringing up. The only thing that I've seen them ask is 5th or 6th week in prenatal life is whenever the dental development begins. The 7th week epithelial skin cells, they might ask something like that, but I've never seen that. Also, the total growth periods is divided into bud, cap, and bell stage. I've seen that on multiple exams. Bud, cap, bell stages. Those are the only stages. I'll give you guys a minute. Mm-hmm. Yeah, sure.
No, however you want to do it.
Okay, you can hit the next one, because we'll go over the stages a little bit. I won't harp on them.
You ready?
Go for it. Bud stage is the first stage. That's the only thing I've ever seen them ask. Bud stage is the first stage. All of this, I wouldn't get into the weeds with it. Next one, cap stage. So that's when the actual crown of the tooth is being developed. And then bell stage is the last stage. That's whenever the tissues are developing, like the enamel, the dentin, and the cementum. Has anybody seen them ask like specifics about the stages? All I've ever seen are the names of the stages. So I would just focus on bud first, cap, and just remember the cap of the tooth, the crown or cap of the tooth, and then bell is the last one. So I think dinner bell. Everything's done, dinner bell is the last one. Next slide. I have a bunch of like little weird things to help me remember things. So if your all's mind works like that, I'm going to throw out some like random stuff. If not, ignore me. Morphodifferentation. I haven't seen them ask about anything about that, but that's your tooth. That's the process of your tooth taking shape. I haven't seen them ask anything about calcification or eruption. Next slide. Exfoliating is whenever, as a kid, you're losing teeth. Nothing from here. Next slide. So your tooth is divided into two parts, the crown and the roots. Next slide. So I have seen something, even if it's not asking specifically, I've seen something on the exam about, I would know the apex is the very end of the tooth, or the tooth root. The cervical line is where the root and the tooth meet. And then I've seen questions where they'll ask a question and they'll have as answers clinical crown and anatomical crown.
So an easy way to remember all of this, right? Apex, right? Usually when apex you're talking about kind of mountaintops, right? So the tip, right? So the apex of the tooth is literally the tip of the tooth, right? Clinical crown, easiest way to know that is the part of the tooth you can see is the clinical crown.
That's what I was getting to. So the cervical line is where the root and the crown meet. Anatomical crown is everything covered in enamel. So the anatomical is big body, anatomical parts, the whole crown. Clinical crown, so while you're in the dental clinic, what we can see. So the part that's you can see after the gum. So in the clinic, you see this part of the crown. Anatomical, that's the actual whole crown, which you can't always see. So I've seen answer choices where it'll have both. And so just think of that whatever the question may be. Remember, clinical crown is what you see with your eyeballs. Anatomical crown is the actual entire crown. Next slide.
That's usually what's asked on the test, is what part of the tooth is visible.
To see the anatomical crown? No, right?
No.
You can see some of it, but not the whole thing. So there is some part of your tooth underneath the gum tissue that still has enamel that you can't see with your eyeballs.
Okay.
So that's why there's a difference between the two. Any other questions? Does that make sense?
Mm-hmm.
Okay.
Yeah.
Yeah.
Yeah, because the last exam was cervical crown. On the last one, we had that one.
So we'll get there. I'm trying not to jump too far ahead. Because there are some slides coming up that will kind of get into the CEJ and everything. The root is covered with cementum. I have seen questions where they mention cementum. So, next slide. It goes into cementum a little bit.
An easy way to remember the cementum, because it's basically a foundation for the tooth, right? Cement is like concrete, right? Usually that's how you build a foundation on any kind of projects. So that's how you can help remember that, with cementum being the support for the root.
So for cementum, I just think cement is what keeps the actual tooth encased in the bone. It's not sticky, but that's what I think of in my brain. It's like it's around the roots to keep it in the bone, kind of. You can hit the next slide. They won't ask anything about that. Enamel, we went over enamel a little bit. I have seen something about approximately how much inorganic and organic material, and also, so you could write that down. It's been a while since I've seen that on an exam, but they could ask it. And then also, what I have seen that can endure pressure of approximately 100,000 psi. And just for your, well, I'll let you guys write that down and I'll bring that up. But just for your all's personal information, because I see it all the time in commercials and people come in asking, once formation is complete, new enamel cannot be reformed. You can't rebuild enamel. I see it all the time on the commercials. People ask me about enamel. What you got right now is all that you get. But they won't ask that, just for you guys. Also, another thing that I've seen on the exam about enamel, it is the hardest tissue in the body.
And you said you've seen
The PSI.
Crushing?
Mm-hmm.
Pressure.
I've seen, sorry, I don't want to backtrack, but I've seen apical foramen that was on the slide before with that, and I want to kind of describe that to you. It makes the most sense, okay? So we talked about the apex, right, is at the top of the root. The pain center or the life of the tooth is within the pulp that goes inside that root. So that opening that goes into the pulp from the apex is called the apical foramen.
Right.
Say what?
Hole at the apex. Foramen means hole.
Mm-hmm.
The apex. Okay, next slide. So this is a little quiz, but the structure of a tooth, in the middle is the dental pulp. Around the dental pulp is the dentin. Around the dentin is the enamel. We talked about cementum. Teeth are embedded, roots supported. So it's kind of like the cement around the roots that keeps it into the bone. Alveolar process is the bone surrounding the tooth. I've seen a couple of things about alveolar process, but just remember it's the bone around the tooth. So the cementum, there's cementum, and then cementum is inside keeping the tooth. I'm visual. Yeah, so cementum is on the root, then there's root, cementum, alveolar process. That's the bone it's keeping it into. Alveolar bone or alveolar process. I haven't seen anything about periodontal ligament. If they do ask, it connects the tooth to the socket. Next slide. Dentin. I haven't seen them ask too much about dentin, but just know it's porous and it is sensitive. That's what the enamel is protecting, is the sensitive dentin, and the pulp as well, but the enamel is right over the dentin. And it's usually yellow in color, light yellow substance.
This has been on the test for a couple points that are on here. Largest portion of the tooth is usually what's been the test question for dentin, and then the light yellow substance. They'll mention something in the question about what's the light yellow substance of a tooth. You got to know that that's your dentin.
I have not seen them ask about the material of the dentin. Right, next slide. We talked about cementum a little bit. Cementum joins the enamel at the cervix of the tooth, forming the CEJ. So I have seen things on the exam about CEJ, and people always come up and ask me after. So just know the cementum joins the enamel at the cervix of the tooth, forming the CEJ. CEJ is cementum enamel junction. Which makes sense if you think about it. So it's the junction of the cementum and the enamel. Primary function of the cementum is to anchor the tooth into sockets in the periodontal. Okay, next slide.
Oh, 1 second. Please.
Go ahead.
I'm sorry.
No, you're
Let me
good.
go back.
The previous slide.
This one.
Okay, I'm done. Thank you.
So the dental pulp, it's right in the middle, pulp chamber. The primary function is to form dentin and provide nourishment to the dentin. So as we were talking about before, I'm very visual, so like when there's pictures, I like to show. So the pulp is right there in the middle. I don't know if you can see, it's kind of light, but like he said, the largest portion of the tooth is the dentin. And then that little line with the white layer, that's the enamel sitting on top. So as you can see, the largest portion is dentin.
Like I said, the pulp, the easiest way to remember is the pain center or life of the tooth. So if you ever hear about the pulp being dead or they're testing the pulp, right, that is usually when they decide to either keep your tooth or take your tooth out, right? Because there's not life coming to the tooth, then what's ultimately going to happen is that tooth is just going to rot away in the mouth. So they end up removing it anyways and putting in prosthetics in that situation.
Next slide. Alveolar socket, it's just the socket that's left after they pull a tooth out. So as you can see, they kind of pull the tooth out and that's the socket. Haven't seen anything about that. Next slide. Periodontal ligament. I haven't, from my memory, I haven't seen anything about a periodontal ligament, but I would know that it's ligament that connects the tooth to the bony socket. This is what I was. The fibers act as a shock absorber. So that's what I would know about it. That's like the main things about a periodontal ligament. In case they do decide to ask something about it. But it connects the tooth to the socket and it acts as a shock absorber. So whenever we're biting and chewing, that's the pressure that the pressure is being put on the periodontal ligament. Next slide. Tissues of the oral cavity. I haven't seen them ask anything about. I've seen oral mucosa, but that's the tissues within your mouth. I haven't seen them go into specifics about the lining, specialized masticatory mucosa. Next slide. Gingiva. There's two types of gingiva, attached and unattached. Ranges of colors. Next slide, it should go into attached and unattached a little bit. Unattached is known as free gingiva. It's about 1 millimeter between the tooth and the attached gingiva. There's not much unattached gingiva. In a healthy mouth, this is approximately 1 millimeter to 3 millimeters wide. Attached firmly, so like that's the top part of our gums. That's the attached gingiva. I haven't really seen them ask too much about that. I have seen the word free gingiva in test questions, so, but not too much. Next slide. Dentition. We have 32 permanent teeth and 20 primary teeth or deciduous teeth.
There's an easy way to remember that I want to show you all. I know there's going to be a chart that's going to come up, but your 20 primary teeth are basically everything but your third molars. So you have 3 third molars here, 3 third molars here, 3 molars here and here, right? Those are the last teeth that take to grow in, so i.e. your wisdom teeth, okay? So all that is including is your premolars to premolars on each side. So when we see the chart, I'm going to show it to you where the letters match up, to where you're always going to know that primary teeth is 20 and the normal teeth is permanent teeth is 32.
Yeah, so there's 20 primary, 20 baby teeth, 32 adult teeth. Next slide. Incisors, those are our teeth up front. We use those to cut food, so I have seen something like that before. Incisors are used to bite into and to cut food. Go ahead, HM1.
Alright, so I just want to show you since we have the chart up here, okay? So you see these labels here where it has third, second, and first molar, right? These are your big teeth in the back of your mouth, okay? So primary teeth is you're basically not including the 3 here, 3 here, 3 here, and 3 here. Okay, does that make sense? You're only getting second bicuspid all the way to the second bicuspid on the other side, right? So whenever you're counting teeth, it's the easiest to do it. And we always go from right to left, down, left to right. So if we're looking this way, it would be A through J, and then K through T. So then just A to T for your letters, right? Does that make sense to y'all? Okay. Somebody say no?
So left and right.
You go from right to left.
Right to left, down, left to right. So
So right to left.
So you go bam, bam, bam. You start with the right and end on the right.
Okay.
Yeah.
I see what you're saying. Okay. Now,
yes.
Okay. So I have seen them ask about specific teeth. Remember them if you want to. If it's not that big of a deal to you, you can skip over it or ignore me. But I have seen them ask things like incisors are used to cut food. Gives a shovel-shaped appearance. So those are our teeth in the front. I haven't really seen them ask about canines or cuspids. Bicuspids are our premolars. They help with crushing food and cutting and tearing food, but molars are used for grinding and chewing solid foods. So the two that I would remember are incisors and molars. Molars, like I said, help crush and tear food. They assist, but molars are the ones grinding and chewing. Incisors are shovel-shaped. I always think of biting into an apple. You use your front teeth. You're using it to cut an apple. And then you use your molars to grind it up to swallow.
That's why when you try opening up a piece of plastic with your mouth, and it's a struggle, because it's usually when you're trying to use your chewing teeth instead of your actual canines, it's going to rip through the package. I'm sorry about that.
No, you're fine. Universal numbering system. That's the only system that they'll ask you. Well, they'll throw some more in there. The only one we use is universal numbering system. And that's what we were talking about, from right to left, down, and then from left to right. So start with the right, end with the right. And it's 1 through 16, 17 through 32. Sometimes they throw in numbers and letters, but just know if they ask about a numbering system, universal numbering system. They usually throw in standard, that's not it, universal numbering system.
There's a chart on the next page that shows it.
Go ahead. Yep, and then it shows it to you.
You guys see what I'm talking about with the third molars being off of there? See the difference between the two pictures there?
Okay. So anything with an alphabet is your deciduous teeth,
Correct.
and numbers are your permanent.
Correct.
Correct.
Next slide. Knowledge check, I'll let you guys do that on your own, okay? Unless you wanna go through them real quick?
Yeah, sure.
Okay. How many primary teeth do humans have? Correct. How many permanent teeth do humans have? 32 permanent teeth. How are primary teeth identified? A, B, C. How are permanent teeth identified? Universal numbering system, so numbers. Next slide. Two surfaces. So facial, towards the face, we usually use facial whenever we're talking about the teeth up front. So, but interchangeable, it can be interchangeable, but not usually. It's facial and buccal. Buccal, for those who know medical terminology, buccal refers to the cheek. So whenever we're talking about the back teeth, they could say facial, but usually they'll say buccal. But facial and buccal facing or towards the face. Mesial, so same with the body, the midline. So it goes between your front two teeth, your bottom front teeth as well. If it's facing the midline, it's mesial. It's away from the midline, it's distal. Lingual surfaces are facing the tongue. So there's facial and there's lingual. Mesial, distal. Does that make sense?
Are you sure it makes sense? I just want to ask. So midline is between 8 and 9. So we have a single tooth. So if it's on, say that I'm looking this way, and it's on the further part of this tooth, that's going to be the distal of that tooth. Now if it's on the side closer to that midline on that one individual tooth, that's the mesial side of that tooth.
Question on this slide is there because it was something on the test that was like this person is facing 12 o'clock, 2 o'clock.
So
like,
they were asking about. I was just about to get to that. They were asking about what position does the operator sit at when they're doing the lingual surfaces of. I don't know if they use the word mandibular anterior or
Yep.
if they use the numbers.
It also
like the 12 o'clock.
It also depends on the what handed the dentist is.
That
It
one it
switches.
doesn't, because the answer to that is 12 o'clock. Whenever you're doing these front teeth and the lingual, you're sitting, the patient is at the head.
So facial and lingual is 12 o'clock?
Lingual.
Lingual is 12 o'clock.
Mm-hmm. Lingual of the bottom front teeth is 12 o'clock. I think we'll probably see that one again.
Yeah, it's in the
So,
operative dentistry
I
chapter.
wasn't going to leave here without telling you guys that, because I always get that question.
I ain't
now.
mean to like,
No.
the toes, but I was saying like.
No, you're fine. I already knew that was coming. They always ask at least one question about the clock, and everybody's like, what is your clock? So the lingual surfaces, if your tongue touches it, it's lingual. It's resting, if your tongue touches it. Occlusal, that's the part of your teeth that you use to chew. So, especially on the molars, I think of molars whenever I think of occlusal. Those parts that you chew on, yes. Confusing?
It's not confusing, but you said that, how was the question worded?
It was
I don't
like-
remember seeing
So,
it.
I know what you're talking about. What position is the dentist at while performing this procedure?
You'll see it in the operative dentistry chapter, but again, that's where, and I want to go into detail when the picture's actually up there. But it's all based off of the what hand the dentist is. If he's a left-handed dentist, the zones are going to change for the operator and the assistant zone. And if he's a right-handed dentist, those zones flip. You'll see it's confusing for me to explain without the picture, but those two flip.
I don't remember that.
Because the static zone stays the same, and the transfer zone always stays the same. It's literally just the operator and assistant zones that flop based off of what handed the dentist is.
So, whenever we get there, I'll show you. The picture makes it, for me, I'm visual.
Yes.
Which is why I work in dental. But the picture makes it so much easier. They put a clock. The patient's head is 12 o'clock. Everything else goes around the patient. And there are certain zones where it's like where you pass instruments. Where does the provider sit whenever doing this? And I was surprised to see that question because I remember it and I knew it was coming. Whenever you're working, if this is my patient, if this is their head, the bottom front teeth, working on the lingual surfaces, which is the back of their teeth, what position would the operator, so I'm the operator, I'm working on the patient, what position would I sit at? I'm sitting at 12 o'clock so I can see the inside of their bottom front teeth. So, yeah, we'll go over that whenever we hit that next chapter. I'll run through it real quick. That's probably the one thing that I'm gonna like really harp on that chapter.
Pretty wrong, man.
I hate that, and they always throw at least one in there. So,
Okay, you said you're gonna hop on different positions. Okay.
I'll show you. We'll do the clock, and I'll show you all.
Okay, perfect.
I don't really see too much. Interproximal is in between. So if they ask something, a patient has something stuck interproximal in between the teeth. Or if they're talking about a space, just know interproximal is in
That's
between.
pretty much the Partridge loss, right?
Yep.
Mm.
Next slide. Okay, so whenever the teeth come together, the word for that is occlusion. Whenever we're talking about how the teeth come together, whenever you bite down, we're talking about occlusion. If there's an abnormality, malocclusion. So for those of you who know medical terminology, mal is bad, and then occlusion. Go ahead, next slide. Have they asked Curve of Wilson?
I've never seen it, but this is my first time seeing Curve of Wilson, period. So how about we just hit it?
Okay. So curve of Wilson is the mandibular arch. It forms a concave bowl. So this is the curve of Wilson right here. I don't think I've ever seen them answer or ask that.
Very rarely do they ask that question. The one they like to ask, and I'm pretty sure it's on the next slide, yep, is the angle classifications.
So class 1 is normal. That's when your teeth come together. Normal. Class 2. Oh, perfect. Thank you.
Don't go to sleep, nobody.
It's dental. They're all going to fall asleep.
Okay, I'm sorry.
No, you're good. Class 2, that's what most people call a overbite. So back to medical terminology, retrognathic, they're talking about the chin. The chin is back. Retro is back. So class 2 is overbite. Class 3 is prognathic. So the chin is forward.
Looking like Crimson Chin.
I've seen class 3 on the exam. So class 3 is overbite,
Is that
like a bulldog.
oh, okay. I was
Underbite.
gonna say like the crimson chin, but.
Yep.
Yeah, like the crimson chin too.
The word
Pragmatic.
prognathism on the test, or is it the
It could-
overbite thing?
It could, so they could use either or.
Okay.
They could use prognathic or class or overbite, or they could ask about class 3 occlusion.
Class 2, not enough chin. Class 3,
Too much. Yep.
oh, the picture like
Yeah. So that's why I was saying retro is the chin is back. Prognathic is in front. Class 1 is what we went with whenever they come together evenly. Next slide. I haven't really seen them ask about how the teeth come together, or like, there's more to classifications that I haven't seen them get into the weeds of that.
Are you able to go back to the slide that had the,
You got a lot of questions, man. No, I got you.
Which one do you need?
I'm gonna keep asking them. I'd rather over ask than not ask enough.
No, I
and
got
get
you.
home and look crazy. You remember how the numbering system when you,
You need me to go back?
Yes,
Okay.
please, cause she's gonna show us the different,
Tell me when to stop.
Oh,
You good right there?
no, that's another chapter.
That's another chapter.
Okay, sorry.
It's coming. You're fine.
So I wanted to tell you, preface that at the beginning of class, right? Because everybody always likes to complain about dental, right? Does anybody know how many dental chapters are in the Corpsman manual? There's 5. There's a 5th of the Corpsman manual is dental, right? And then dental also branches off in a lot of other instructions with your infection control, your waste, your mercury. But people are like, why are there so many dental questions? Sterilization, precious metals. That's why there's a lot of dental on the test. But there's 5 chapters, and honestly, most dental questions they pull are from the Corpsman manual. Especially when the ones that I know that I want to hit on that's going to be hard for you guys are the oral diseases. Because they're going to give you scenarios and you have to guess what the oral disease is.
Honestly, they only asked about maybe the same 4 oral diseases only. So we're gonna run through that
I
one.
don't really care about that.
Oral pathology.
If you haven't done the Corman manual since like, when it first came out, you don't remember that stuff. Especially when you're not doing it.
I highly suggest if you haven't, and I know the newer people they can't get it, is getting your copy of the Corman manual to already have.
Yeah, you can find a PDF.
Because I have that binder with me at all times. I have a binder at home that just has the Corman manual in it with all the highlights. Mm. Still have my BMR manual too.
I'm coming in.
Shit, you the real MVP.
That's why I was like, hey, I have an appointment.
Shit, I still got my Blue Jacketeers manual from boot camp sitting in there, and my recruit guidebook. I'm like, maybe I need to see my UCMJ articles. Let me pull up my recruit handbook real quick.
But you guys don't still have your
Right?
I haven't got the 25th.
Y'all ready for
What's the-
chapter 8, or do y'all need a break?
Ooh, chapter 8. Chapter 8.
You guys wanna take a quick break?
No,
Question?
We'll do one after this, because this one we're gonna go through real quick, okay?